Mackinlay.
Thank you, Mr Speaker. This is an emotional day for me, and if you would indulge me to say a few thanks, because there are a few are due. And one of those, of course, well, an apology, actually, that I've caused the breaking of so many rules today. Clapping. I've got trainers on because my shoes wouldn't go over the plastic feet, and my jacket wouldn't go over the bionic arm. So apologies for that. But I want to give some thanks. And first of all, the thanks to you, Mr Speaker, for being there for me, for coming to visit. And I will tell everybody the little story. They thought, the rest of the hospital thought I must be dreadfully ill, because they said, that guy's got the funeral director in already. But no, you've cared for me throughout, and I thank you for that. The other person in this chamber I'd like to thank is the Prime Minister, who's been with me throughout. He hasn't advertised it. He's been to see me multiple times. And to me, that shows the true depth of the character of the Prime Minister, and thank you for that. And to my wife, who's in the chamber, and my daughter and other family members, my father-in-law. I'd like to thank my wife for being there every single day of those many months in hospital. And she could only do that because of the support of family behind her. And in the public gallery, they can't quite see me, unfortunately, are many of the staff from the NHS who took me from where I was, close to death, they took me from close to death to where I am today, so thank you for that. I'm not entirely sure I'm that happy that the two surgeons who took this lot off are there, but never mind. But can I ask the Prime Minister, there is a question here. Prime Minister, can we please ensure that we embed recognition of early signs of sepsis? It wouldn't have worked for me, mine was too quick and too sudden. But for many people, they do get a few days. If we can stop somebody ending up like this, I would say that's a job well done. But also, Mr Speaker, to impress upon your health ministers to allow the provision of appropriate prosthetics, particularly for multi-limb amputees, at the right time. Thank you, Mr Speaker. Thank you.
Prime Minister.
Mr Speaker, it's so wonderful to hear from my honourable friend. Can I thank him for his kind words, but also personally pay tribute to his family who are here. And I know firsthand the extraordinary job they did to support him over the past several months, and they all deserve our absolute admiration and thanks for what they've done. And on the substantive question that he raises, before I do that, can I also join him in paying tribute to the NHS workers who looked after him? He's right that sepsis is a devastating condition, and we're working hard to raise awareness of it, and I know that he will play a leading role in doing that. And without getting into all the details, I'll just say that he is right. The NHS itself has recognised this morning that more needs to be done, and I can assure him that we will do that. The Right Honourable Friend will discuss with him shortly, as will I, his suggestions on how we can improve care and awareness for people. But I'll end where I started earlier today, Mr Speaker, and just say, Craig, you've inspired each and every one of us. Thank you.
That completes Prime Minister's questions.